now we assume that you have data. Okay. So we have moved on from our previous discussion. Now our belief is you have some data. Okay. Now, once you have data, maybe in table form like this, maybe you have data in table form. This is a sample table, not connected to any of the work that you are doing. So we present the data in table. If you remember Mukeshji's slides, there was one table where they have presented the yearly targets and what was achieved in terms of their notifications across the different health conditions under consideration. There was a nice big table. So they have summarized some data. Okay. So tabulation is also a way to summarize data. But what we need is, if you put tables, no, like this table you see on screen, if you put tables, it is very difficult for somebody to understand what the table means. Like in this particular sheet that you are seeing, you see the scroller, correct, no? Which means I can only see around 22 rows of data. I can only see data from 22 people. Whereas there are more than hundreds of people involved in this particular study. So the count is actually 132 if you notice. There are 132 rows in the data, of which you are only seeing 23. Okay. And nobody is understanding what this data is all about. That is where graphs or visualization approaches help us. Okay. Visualization approaches help us understand our data better. So we learned what is data, what is individual, what is measurement, what is a data set. All these topics were covered in my previous discussion with you. So today we are going to explore together not how to make tables. Okay. We are not going to see how to make tables. This is not our agenda of discussion for today. Our agenda of discussion for today is how to visualize data. Okay. That is what we are going to see today. So how to how to visualize data. That is what we are going to see today. And we will explore some charts. For example, bar chart, which was beautifully used by Doctors for You team. There are actually no corrections. There is nothing wrong in that. But there is some things maybe you can think of and improve the existing visualization. We also have something called pie chart, which we are going to see together. We also have something called line chart. We also have something called scatter diagram. We also have something called frequency polygon and histogram. So these are some of the topics that we are going to see today. Okay. Now, why we are going to see why tables are not, no, tables are fine, no? Need visualizations because visualizations sometimes gives you answers to questions that we never knew. We don't know the question only, but suddenly we look at a graph and we get the answer to something that we did not even think of. So that is the beauty of visualization. I'm sure all of you have heard of a picture is worth 1,000 words quote. So with that motivation, we are going to go ahead. Now, what I intend to do is I intend to present some graphs. Okay. First, we will see what, how to interpret it. What does it mean? And then we will learn a bit about it. So on my screen, there is a graph, okay, that talks about medication adherence, okay, and recovery time. Okay. So what the project staff has done is, project staff has looked into patient level data and looked at, okay, what percentage out of the, let's say, 8-week treatment, what percent of the days were you taking the treatment properly and how much time you got to recover. Okay, that is what you are seeing in this graph. Now, first I want you to name what this graph is. Any idea on what this graph is all about? Any name? You can unmute if you know. If you don't know also, you can tell, that's okay. What what is the name of this graph?
It's a scatter plot.
Perfect.
Yeah.
Yes, thank
It's a
you.
scatter plot of yeah. It's a scatter plot of visualizing or analyzing the data against of the adherence versus what the recovery time is. So here we can actually interpret out here also like the recovery time of say 18 weeks is like just only 40% of the medication is being adhered. So this is what the interpretation of this is.
Thank you so much, Chandan, for naming it correctly. I hope I got your name also correct. Chandan, no?
Yes, ma'am. And actually, I was your student in Manipal and
MIRM?
no, MPH.
Oh,
Biostats, yeah. So
wow.
it's really, yeah, it's really good to listen to your lecture back, apart from the academics.
Okay, pleasure meeting you. This is a surprise
Yeah.
for me. Okay, my day is done.
Yeah. Thank you.
Yes. So, Chandan did the right interpretation also. Okay, I'm so happy, man. Okay. So, what has happened here is the name of the plot is actually scatter plot. Okay, scatter. See, different points are scattered. It's just like our dots in Rangoli, got scattered on the floor. Okay, so scatter plot. That is the name of this plot. Now, why did the researcher or the project research assistant use this? Because she wanted to see. Okay, she wanted to know more the adherence, faster the recovery. Correct, no, Mukesh ji? The more you adhere to the medication, faster is your recovery.
Yes, yes, ma'am.
So she wanted to know, is that true? Okay. So what she did, she collected data from patients, TB patients. She asked them, okay, out of 10 days, how many days did you not follow this medication? So one lady will tell, no. I followed for 7 days. Out of 10 days, 7 days I followed, madam. And so 70% becomes my adherence. Okay. And then looked at the records, checked how many weeks she took to recover. Similarly, data was collected from a lot of TB patients. Okay. And then they have plotted a scatter diagram. So what I understand is more the adherence. So here adherence is 100%. Faster the recovery. Okay. Faster the recovery. So if you look at this, 75% adherence. How do I interpret? I look down and I draw a line and I look left and I draw a line for each point. Then I will know how much time that person took and what was the person's adherence. So my understanding is, if you look at it, the graph is going down, no? If you plot a straight line, the graph is going down, no? Correct? The line
Ji,
is
ma'am.
going
Ji.
down, no? It's like a hill, you're coming down from a hill. So it gives me an interpretation that if you adhere to the medication at least 70% of the time, okay, the treatment promises recovery within 6 weeks. Okay, the treatment promises recovery within 6 weeks if you adhere to the medication 70% of the time. So suppose the intervention is for 20 days. Okay. If you follow the medicines for 14 days, you have a very high chance of recovery within 6 weeks. How did I know this? I collected data. I plotted a scatter diagram. Okay. A scatter diagram will help you understand relationship. Okay. Are they related? Is there a connection? Is there a connection between medical adherence and recovery time? Okay. Is there any form of relationship? What will happen if I follow my medication on time? Answers to such questions, you will get it with the help of a scatter plot. Okay. Is that idea clear?
Yes, ma'am. Yes, ma'am.
Yes. So now we have one more. Okay. We have one more. Now, I would want the remaining team members to think of, because now Chandan is formally excused. He's my student. So, I want you to look into the graph and tell me what you understood. And then we will interpret this together. Now, instead of medication adherence, we have the BMI of people. Okay. So, BMI when they started the treatment and how much time they took to recover. BMI, आपको पता है BMI, body mass index?
Yes, yes, ma'am.
For healthy people, body mass index will be between For healthy people, it will be between 18 to 24 approximately in India. Okay. If you have BMI more than 24, you are called obese. The health risks are there for you. And if your BMI is less than 18, you are underweight. That is also, puts you on a health risk for several other conditions. So, what did the research staff do? He collected height and weight of the patients who are coming for treatment. Sorry, just a minute. So, yes. So, less than 18, it is actually considered to be not healthy, underweight. Again, risk for participants, study participants. Okay. So, what is the interpretation based on your finding? What is the interpretation?
Ma'am, in this slide, we can allocate the recovery of patients that how much changes comes in their BMI. Through it, we can understand the quick recovery.
Yes. So what we see is, you look at this range, healthy people. This is healthy people range, 18 to 25. Correct, no? BMI. Okay. So healthy people are able to recover slightly faster than obese people. See? So obesity is a risk. Okay. Obesity is becoming a risk for treatment of TB. That is what we find. See, these are all people with high BMI. Correct, no?
Yes, ma'am. Yes, ma'am.
See, look at their recovery time. They are taking more time to recover. Correct? See, all values are high.
Yes, ma'am.
And for people who are underweight, what is happening is their recovery time is becoming fast if they are moving towards healthy BMI. So with this particular data, we can actually tell that body mass index is a risk factor in treatment of TB. Okay. With the help of data only, we are proving, okay. Maybe different if you pick your data from another state. That is also possible. So now, here we understand, and what we can do? We can tell the patients, we can look at their BMI and tell them to focus on their nutrition and sleep and stress and ensure that their BMI comes down to the normal range so that TB treatment works more effectively. So with a single scatter plot, we can give that advice. So with the help of
Yes,
data and then a scatter plot, we are able to give that advice to patients who are taking the treatment.
yes, ma'am. Yes,
Okay.
ma'am.
So that is what one small scatter plot only for the patient level data. We are able to understand the relationship between BMI and recovery time. So if you combine both the graphs, you can tell them the moment they enroll into the program, you can tell them, please adhere to medication at least 70% of the time. I know that 100% is not always possible because you may be working, you may have some financial constraints, you may have lack of awareness. Okay, fine. You might be forgetful. Okay, 100 is it's a challenge. But at least follow it 70% of the time. Okay, and have a control over your, if the person is very overweight, you can ask the person, okay, you can do something to, let the weight also come down because cannot change height. So let the weight reduce, have nutritious food, avoid fatty food. You can give a list of advices only you can give when the patient enrolls for the treatment. And that will help speed up the recovery. Faster recovery rates, lesser mortality, more effective is the intervention. How did I make this story? From data with the help of a scatter plot. Okay. Now,
Yes.
so scatter plot, the the graphs that we got, they are very pretty. But now the dots can take different shape. This is an increasing trend. So it means when one variable is increasing, when one characteristic is increasing, the other one is also increasing. It can also have a negative trend as we saw in the first. More adherence, faster recovery. Okay. It can also take a random shapes like this, as you see. I just wanted to show you different ways scatter plot looks like. Okay. You can also do a 3D scatter plot. However, 3D diagrams are not easy for us to interpret. Like if I show you this, you will be like, Madam, ये क्या चल रहा है? मुझे कुछ भी पता नहीं चल रहा है. See, you don't know what is X, what is Y, what is Z. I'm sure all of you watch 3D movies. 3D movies itself is a challenge with the glass. After you finish the movie, at least some of you will get headache. So similarly, you understand what is actually happening from the data. So it is best that you restrict yourself to 2D diagrams because it will give us more clarity, in this case, on the relationship between the variables. Now, moving on to the next diagram. Have you ever seen this ad? Crispello?
Yes, ma'am.
हाँ, ad देखा है ना आपने?
Yes,
Crispello
yes,
का?
yes.
4 friends in a car and they break, send the 5th one out. Yes. So this is a Crispello bar, right? So we are going to study bar chart. Okay. Now, here I have come up with another chart. Yes. Now, what is the interpretation for this? All of us are experts in bar chart, that I must say. So, quick interpretation.
Ma'am, here you have shown TB treatment completion rate
Ah.
and middle socioeconomic status.
Mm.
मतलब it shows that the higher socioeconomical whose economical status is better, is treatment completion is better. Means he recovers soon. They are paying attention more on their diet. As I
Yes.
understand, ma'am.
So, rich people complete TB treatment. True or false? Faster than anybody else.
True.
Yeah, looks like it. Okay. Because the tallest bar, height of the bar tells you what is the true story. So it looks like higher socioeconomic, people with higher socioeconomic status have a higher completion rate. So this is actually 90%. Okay. And this is around 70, more than around 75%. How did I know? I just looked this side. Okay. And this should be around approximately
58%.
55%. Yes, perfect. Now, you should also look at the number of participants. Okay. Percentages are very good. But if it is 100 among the 100 high socio-economic status people, 90 people completed the treatment. So adherence or treatment completion rate is high. So what information does this tell us? If this is the trend that our data is showing us, it means when people fill up their form, the moment we realize that their socioeconomic status is low, our alert system only should be different. Okay. Probably instead of SMS or WhatsApp message, we should call them or we should go and meet them so that they complete the treatment. I'm sure you would have had an experience where the patient only is missing from that area. You are trying to call him, the number goes somewhere else, and that person says, I don't know. And then you visit that place, the person is not there in that address. Okay. Have you experienced that?
Yes, ma'am. Yes, ma'am.
Yeah, they will go missing only. And that challenge also happens for probably low and middle, not
Yes, ma'am.
not high socioeconomic status. So it means when we are developing strategies, when we are planning strategies to ensure adherence, we should keep it separately for the three groups. Same method for all the three will not work. Maybe we'll have to be in touch with the ASHA worker and, get her support to track where these people are going. Maybe we should get some additional information on where they work, what they do. Or maybe we should have one more contact detail. If it's a person, a man who's having TB, maybe we should have that person's mother or spouse or somebody. One extra contact number we should capture. So we get all these ideas when we look at the bar chart only. Okay. The fact that we should see the three groups, the three different classes separately to ensure better completion rate. How did I know this? I knew it because I collected data and I came up with a bar chart. That is the only way I could know all these things. If I just had an Excel sheet, I may not have even seen this possibility. Okay. So that is why when we started, I told you data visualization will help you find answers to questions which you never knew. Okay. So now we know that socioeconomic status has a role to play. Now, moving on, comparison of TB medication across regions now. Okay. So previous one was socioeconomic status.
Yes, ma'am.
Okay. Now this was a simple vertical bar chart. Now here you are seeing 3 bars. Okay. 3 bars you are seeing. Okay. And if you look at it, this bar's height is 60. Okay. This bar's height is 30. And this bar's height is 10. So each bar, each group will add up to 100 if you notice.
Yes, ma'am.
So the first lesson we learned was avoid 3D graphs as much as possible because interpreting a 3D graph is not easy. Okay. Second lesson. This lesson comes from Mukesh Ji's charts. Always put numbers in the graph. Don't leave the graph just like that. Always put numbers and put numbers in a way that it is readable. Okay. Avoid putting numbers on top because what will happen? Now this bar will look taller to me because I entered data here. So you can actually put a small box inside and then enter the number. Otherwise,
Okay.
the graph will appear taller. It's like giving heels to a woman. A 5 feet 2 inch woman, she will have an 8-inch heel and then she will be 5'10". Okay.
Yes. Okay,
Don't,
ma'am.
don't give heels. Okay. We need
Okay, ma'am.
original look only. Okay. The
Okay,
third
ma'am.
thing that I want to tell you is be very careful about colors. Okay. Bright colors like this, never. Okay. And we have something called color blindness. Have you heard of it?
Yes, ma'am.
So a lot of people around us, it could be a policy maker whom you are giving this report to. It could be, you are giving the report to your boss also, or you are publishing your report in a newspaper or a journal. There are a lot of people who cannot distinguish, who cannot understand differences between colors. So for them, all these three will be different colors of gray only. And some of them will look similar also. So please be very careful when you are choosing colors. Bright colors, fluorescent colors, please avoid. Okay. Please be careful then. And the fourth tip is always this should start with 0. Your x and your y axis should start with 0. You cannot
Okay.
start with 150 or 10 or anything. It should start with 0 so that you can compare between the heights of different bars. Okay. Sometimes Excel forgets this. So you only have to remind Excel by fixing the axis in advance. Okay. Please be careful there. Now, here what do we find? What is your finding?
Here, ma'am, you have shared the adherence percentage of adherence percentage you have shared it, ma'am.
Yes.
High, moderate, and a low adherence. Maximum 60% adherence in urban and moderate 30% and 10% in a low adherence. And same जो है in suburban and rural are shown there, ma'am.
So what do I find? It looks like urban people. Okay, urban people have
More aware.
relatively high adherence. Yes.
They are more aware.
More aware, and all, suppose you are giving SMS or WhatsApp notifications, they are getting notifications, they are in network. That is also
Yes.
there, no? Sometimes you
Yes.
send, you will get double tick, but blue tick will never come if it's a WhatsApp message. Or maybe it's a single tick also. We don't know. So we need to also look into what all methods we are doing to ensure adherence, and the strategies, the plans cannot be same for rural and urban. You have to have a separate set of plans. That is what this tells me. Because in rural, high adherence is only 30%.
Yes, ma'am.
Only 30%. So which means some of my strategies are not working. Okay. So previously you saw socioeconomic status. Then you saw region wise. So if you look at it, highly, probably rich people living in cities tend to adhere to the intervention better than poor people living in villages. That is what I understand from these two bar charts. Again, I need to have data and then come up with charts and then learn more about what are the factors that improve the completion rate of treatments. So I got these ideas from a bar chart and another type of bar chart called cluster bar chart or multiple bar chart. So another example, not very connected to our data, but I just wanted to show you the power of colors. Okay. So here, if you look at it, high, moderate, low, from my color choice, it becomes very easy for me to understand than this. And
Yes, ma'am.
red is always a bit terrifying. So a nice shade of blue, which is also colorblind friendly, it makes my interpretation easier. Okay. So this particular graph I showed to tell you that, yes, there are other ways too. And to never do this. See, now this 43 is as more taller than 45. You saw?
Yes, ma'am.
That is why number should be inside, not outside. Okay. Now, next is the pie chart. Okay. Pie chart is also called part of the whole. For example, you want to know 100 people are there. How many males and how many females? See, part of the whole people. Okay. Now, 100 people are there. How many are having a high level of education, a low level of education, and no education? So, and remember that one person can have only one gender, no, at a given point of time. I will be either a male, female, or other. I will be in the lower economic class or moderate or high. I cannot be in two places, no. Can I be in rural and urban?
What, ma'am?
Can one person be in rural and urban place, location?
Yes, ma'am.
How? Tell me.
Suppose he is working in urban and he stay at night in his rural.
Yes. So if that is possible, then you cannot do a pie chart. Can a person be male and female at a one point of time? Huh? Yes, no.
No, ma'am.
Okay. Can a person be working and not working at the same time?
No, ma'am.
Yeah.
Either will
So,
be working or not working.
yeah. So for working, not working, for gender, you can use the pie chart. But don't use the pie chart for that rural urban setting, because as you said, one person can be in daytime, he can be in an urban setting, and nighttime he can be in rural setting. At that time, probably a bar chart will give us a better idea. Again, you have to look into how you are collecting data and how you are entering data. Okay. So whenever you have part of the whole, example is gender and employment status, you can choose a visualization technique which is called the pie chart. Can
Okay.
one person be in multiple age group?
No, ma'am.
Yeah. So there you can have your pie chart. Okay. Drawing pie chart, Excel will take care. But what you should be cautious about or careful about is all these percentages. After the graph is drawn, all these percentages should add up to 100. 30 plus 40 plus 10 plus 20. It should add up to 100. And here you have to mark the percentages inside and the labels outside. So from here, I understand that majority of the TB cases in one particular locality are in the age group of 15 to 34 years. See, one more additional information. So what I should do, I have to be super careful about.
Ma'am, we can
Yes, sorry.
on pie chart we can share our annual target among all districts. Suppose we are working in 22 districts,
Ah,
and our annual target is 95,000.
ah,
So then here, as you are showing that it is 100%. The
yes.
95,000 will be our 100%, and we can share it among all districts.
There I think bar chart is better than pie chart. I think that is what you have done currently. Correct, no?
Okay, ma'am.
Why? Because how many districts you have?
At present, we are working on 22 districts, ma'am.
So if you do pie chart, your pie chart will look like Ashok Chakra.
Ashok Chakra.
It will have 22 categories, no? So nobody will understand anything, man. So
Okay.
bar chart is a better option. And what you can do is you can go for horizontal bar chart. I will, in a fun way, it is called the sleeping bar chart. Okay.
Okay.
Plus, it
Yes,
will save some
ma'am.
paper also. It will save some paper. You can put your district name nicely here. Correct, no?
Yes, yes, ma'am.
So a sleeping or a horizontal bar chart is a solution there compared to a pie. Pie chart you use only when you have less than or equal to 5 categories. So here we have 4 age groups.
Okay, ma'am.
So you can go up till 5. Otherwise, you will get Ashoka Chakra and his friends, and you will not understand anything. That is the biggest problem with pie. Okay.
Yearly performance, this will pie chart is okay, ma'am.
That
Yearly
also bar chart.
performance,
Bar chart is better.
okay, ma'am.
Again, you will have multiple years, and then people will think year is a group and all. No, it will confuse people. So please go for bar only. Bar or line chart as you have done already. Okay.
Okay, ma'am.
So now problem with pie chart is if I delete this 30, if I delete this 30 and if I delete this 40, you see what will happen? I will not even know from the shape of the pie, I cannot guess it is 30 or 40. Whereas if it is bar, it is easy for me, to make a guess. I didn't write numbers here. It was easy for me to look and then get the numbers, right?
Yes, ma'am.
Yes. So that is the challenge with the pie chart. You have to be, it is as humans, no, it is difficult for us to interpret something in circle shape. It is easy for us in assessing heights. That's how we compare, no? As children, we compare our heights. On the wall and all, we will stand and then draw with pencil and then say, I am taller than my bhaiya. Right, no? So just like that, it's easier for us to understand and compare heights than compare something in circles. That is how human eyes are trained. That is why you will find very less pie charts in use when compared to bar charts, because bar charts are easier to interpret. Okay.
Yeah.
But in this case, from this pie chart, I understand that if a patient comes and his age is between 15 to 34 and he is from rural area and from a lower socioeconomic status, there is a chance that he might not adhere to the treatment or complete the treatment. So maybe he could be a laborer or a student. Okay. And even if treatment is provided for free by the government, maybe he's forgetting or he's not having time or he's just, he feels that he is very young, I'm healthy, I can cure by myself. I trust God and all. You will find a lot of people with superstitious beliefs. We don't know. So if I club all the graphs together, I will be very careful about people in the younger age group living in rural area and with lower socioeconomic status. Now, this was so about bar, pie, and scatter. Okay. Now we move on to the fourth graph of today. Okay. It is called histogram. Histogram. I forgot to put that heading, so that's why I'm writing, okay? Histogram. What is your understanding from this? Just look, it looks very much like bar chart. Yes. What is your understanding?
Age group of TB patients, ma'am. Something number of patients, hospital, and duration, मतलब stay.
Waiting.
Number of patients who stay, how many days they stay in hospital?
Stay in
Ah,
hospital.
yes. Yes, Navneet ji, Neeraj ji, and Mukesh ji. So this is not a bar chart because if you look at the bar chart, in your x-axis, you always had English words, no? Urban, rural, male, female, HIV, DB, correct, no? Or year, correct? Low, moderate, high.
Yes,
But
yes, yes.
here what is happening is you are having numbers both here and here. Okay. So now here what we are doing is we want to know. Now suppose we are telling policymakers to improve the health infrastructure, meaning more beds in the hospital to deal with some emergency cases in TB. Suppose that is the task given to you. So somebody wants to know whether is the health infrastructure adequate to take care of emergency cases in TB. That is, somebody asked you that question and you are asked to prepare a report. So what you will do, you will meet TB patients and then you will ask them, in a year, how many days were you in a hospital? So some people will tell, okay, 7 days. Some people will tell 10 days. Some people will tell 20 days. Okay. Some, different, some people, sorry, here, some people will tell 5 days. Some people will tell 20, 40 and all. People will tell different numbers. So if you look at it, the tallest bar, it's a histogram, please remember. The tallest bar is for 15 days.
20% people stay in
Yeah.
50.
No, but here it is number, okay? It is not percentage. It is number.
20%,
So,
20% stay 50 days.
persons, yes. So it looks like most people, okay, so here the number is around 20. Here the number is around 6. See, you should put numbers, otherwise it's very difficult for anybody to understand your data. Here it is 10. Here it is some 3. Here it is some 6. Okay, so 20, 30, 42, 49. So roughly 50 patients that you have met have stayed for more than 2 weeks. Now you go to the healthcare setting, the government healthcare setting. You count the number of beds and you look at the number of patients. You will be able to find out if the beds are adequate. Suppose there are only 5 beds and there are 500 patients, dedicated for TB emergency cases. It means we are not ready to handle patients. Now it's not only about hospital beds. It could be about medications. So there is, there is some connection to pharmacy, correct? There should be some testing involved. So equipments, okay? Equipments, number of equipments adequate to do screening, testing, diagnosis. Is the person recovering faster? So all these things you will be able to look at if you go back to patients and ask them how many days they stayed, what are the facilities they used, what all medications they took, okay? And then go back and check the health center and see if they have for a month, how prepared are they? Some similar studies you will find during COVID time for COVID vaccination and all. And that medication, remember when COVID wave 1 happened, there was a medication which was massively on sale in hospitals for COVID treatment. So there are studies that looked into patterns or number of cases, whether and how ready are we. Okay. Now, so this is you need a histogram for that. So histogram will help you compare or understand distribution. See distribution, how patients are distributed in terms of 2 numerical variables. One is number of patients in this case and the hospital stay. Could be number of medications they took, whatever. You can have, depending on the research question, you can have different parameters or measurables that you can consider. Here is another one. See here, I replaced scatter plot indirectly with a histogram. So I will get to know how many patients adhered to the medication 100%. So it looks like it is approximately 10. Okay, and if you count, there are more than 100 patients in the study. So overall, 100% adherence is a challenge. That is what I understand. And then I look at the strategies I made to ensure adherence and I realize that something is wrong. And I can actually go back to these 10 people and ask them what is it that made them stick to the... sometimes we need to do that also. You have to go back to this 13 people and ask them why you did not adhere. What stopped you? And then you have to modify your strategy. So having a comprehensive summary of data will help you understand whom to go to and ask what question so that you can plan your strategy. Moving on to the next graph. Yes, this has been used by team doctors for you. Name of the graph, please. Yeah, you did it. Yes.
Forgotten its name, ma'am.
Line plot.
Line plot.
You have actually shown line plot along with the bar to show trends in time. Correct, no? Across years.
Yes, ma'am.
Yeah, it's called line plot only. So the beauty of line plot is always the x-axis will be time. It will be either month, Jan, Feb, March, or Saturday, Sunday, Monday, Tuesday, or year. Okay. Line plot will always have time in the x-axis. Okay. And it is used to present patterns in time. So in your case, adherence across years. Okay. Or a percentage of people whom you reached out to for, through notification option across years. Okay. So to show trends on time, we make use of line chart. So you might think, madam, in reports, I have seen bar chart also. Then why line chart? The problem with bar is you have to look into the height of the bar, no? Oh, increase, oh, decrease, oh, increase, and so on. But if you have the line, it becomes very easy. Oh, sorry. I think I missed some. Yes. So to show trends across time, I need line chart. Okay. To show trends across time, I need line chart. To see parts of the whole, I need pie chart. Okay. To look into relationship between variables, I need scatter plot. Okay. And to assess, in this case, we started off with bar chart. Okay. To look into your socio-demographic comparisons and all, you need bar chart. Okay. So now we move on to, we were doing our line chart. Yes. So what do we see in this line chart? Any understanding? And spot two mistakes. Okay. There are two mistakes.
Ma'am, here you have shared year-wise TV notification.
Sorry.
Year-wise TV notification has been shown.
Yes. In this case, it is TB cases. Yes. Yes. Now, two mistakes. Two mistakes.
Yearly, it has been declined, ma'am.
Oh, yeah.
Declined.
Super. Good interpretation. Yearly decline. Yes. There is one peak here. And then after that, it's like coming down from Kailash. Any mistakes?
Access has not been started from zero.
Super.
Yes.
Wow.
Started from zero.
And then one more. Chotu mistake. You see, data is. Tell me.
Duration between year is more.
And where is 2011? There is a dot, but in the bottom there is no year.
Yes.
So you should have all years, no? Otherwise you should collect once in 2 years. If you are collecting data every year, then you should have that marking in the line plot so that it becomes easy for everybody to understand. These are the two major mistakes in the plot. Okay. Now, if you newspaper and all, people will make big bindi out of this. Okay. It's actually one dot only. Now, if you make it very, very huge, what will happen? I don't know if it is 4,300 or 4,350. So make the dot, don't make it very huge like this. You can use different color for the dot, no? Otherwise, here I will not know. Because if I'm looking at the border of the dot, this is here. If I'm looking at the lower border, it is here. So I'm losing information, correct?
Yes, ma'am.
Yes. So the size of the bindi should be very small in the line chart. Okay. That you should be cautious. You can use an all different color to highlight that actual point. Okay. These are the three things you should be careful about.
Okay, ma'am.
Now, this is another, I'm sure, Mukesh ji, you would have done a study where you are asking, what is stopping you from taking the treatment? Correct, no?
Yes, ma'am.
Yes. So, we also did a small study, not on TB medication actually, but I just made a graph out of it. We asked people, what is stopping you from taking treatment? So, some people were like, Madam, I'm very much afraid of the side effects. I saw this video on YouTube and I'm very tensed. So I feel I should not take it.
Yes.
Okay. Second thing is, oh, I am forgetting it, madam. My work, no, it's 7 o'clock in the morning till 7 o'clock in the night. I take medicines with me every day, but I forget it. It's there in the bag only, madam. Okay. Next thing is, I cannot afford this. I don't have any support from the government or anybody. I cannot pay this much because I would rather pay my, my taxes or my rent or my loan than it's okay. Okay. And then some people are like, oh, I don't need medicines. Yeah. I'm afraid that others will know I have this disease. So I don't want anybody to know. And if my wife comes to know about this, she will kill herself. So I don't want her to know. So I don't want to take medication. And lack of awareness. Okay. I thought this is just fever, madam. Take one paracetamol and I'll be fine. I didn't know that it is so serious. And the last one is access. I don't have access to go and get my medication. I don't have the time for it, or I don't have the way to get it done. So when we do studies of that kind, what we do is, yes, mostly it will be a qualitative study. You could do it on a quantitative way also. You could also collect data, develop a questionnaire, make a nice list of such things and ask people to identify what are their challenges. So in such studies, we use a diagram called Pareto chart. It actually looks like a bar and a line only, which is true. But what we did is, after collecting data, we reordered them and found out the biggest challenge, arranged them. Forgetful is the second biggest concern if you look at it. Okay. Financial constraint is the third biggest concern. See, we may not be able to address all. Like when someone tells financial constraints, I may not have money to help him. Okay. When someone tells transportation issues, I may not be an Ambani to bring a hospital or a clinic or a store close to him. But some things can be addressed. For example, this fear of side effects can definitely be addressed with the help of some awareness initiatives. Forgetfulness can definitely be addressed in this age where everybody has a phone. Stigma can definitely be addressed if you reach out to the family and make them the support system. Lack of awareness can definitely be addressed. Not very costly problem to solve. So if you look at it, side effects, fear of side effects is the biggest problem. And if you can have some nice awareness campaigns, your adherence to medication will improve. So after collecting data, I arranged them in ascending order. And I came to know what are for example, I have another axis here, okay, which tells me that 30% of the people have problem here, okay. Another 10% have maybe another 30, okay. So I understood that 80% of the problems, okay, if you solve these three are the top, high priority problems that if solved, can help you improve adherence in a very faster rate. So a Pareto chart helped me understand this. It's a combination of a line and a bar chart to help me understand what are the barriers that stops people from taking medications. So now, I'm sure you have seen this after every election, you will find this in paper. Correct, no? 540 seats. How many BJP got? How many Congress got? How many others got? One nice chart will come, no? Haven't you seen? It is called waffle chart. आप देखा है sir? Election के बाद color coded by seat and all. Which party gets which seat?
Yes, ma'am. Yes, ma'am.
That chart is actually called waffle chart. Okay. So it will help us understand. So if you look at that waffle chart, you know which party is in power. You need not even read the news. You can even check the recent Delhi election results. Earlier, we used to show tables like, BJP 40 seats, this AAP so many seats, Congress, this others, no and all. Now they come up with our print media is very smart. They come up with a nice visualization. Suppose this color was saffron. I'm very sure that it is BJP who has won the election. I need not even read the news. I need not even do anything. So waffle chart is an alternative to pie chart. Okay. It can be square shaped. It can be circular also. So if you see, there are 10 rows here. If you count, this is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So you are expressing it in percentage. Now if you count this way, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. See, 10 cross 10, 100. So put your data in percentage. So 10, 20, 30, 40, 50, 60, 65%. See, 65% completed treatment. Now 10, 15, 10, 5, 5. So 20. Just need to count the number of boxes. No, you are getting it. You will get to know the percentage of people who have adhered to the treatment. This is an alternative to the pie chart. And it also gives a very nice understanding of what data is telling us. Okay, it's called waffle chart, available in Excel now. Okay, now some do's and don'ts. So rather than giving big lecture, I thought I will show some pictures and you only tell me what the problem is. Okay, I want you to look into this one, this diagram. This diagram. Any problem here?
No chart title, ma'am.
It is actually a pie chart. Okay.
Yeah, pie chart. There is no chart title. It doesn't. It is not informing anything.
It is not telling you anything. And the color code is very confusing, no? Nobody understands. Where is the center of the pie? Correct? Correct, no?
Yes, ma'am.
If you add up and see, you may get 100, 42, 52, 61, 69, 71, 29. So it becomes 100. That and all is there. But the color should start from the center, no? Color should start from the center. This region should have single color. Here what is happening is they colored, it's a 3D diagram, so they colored whichever way they want, and we are not understanding anything. This is the problem with 3D diagrams. Okay, please be cautious. Have a nice 2D pie chart if you are interested. Avoid 3D as much as possible because sometimes nobody understands anything. Okay, now comes this. Please look here. So this is a don't, okay? No. Now look here, please. What is the problem?
On the x-axis, there is nothing written. I mean, what the percentage it is inferring.
Okay, yes, having labeling axis is very, very important. Any other finding?
On the y-axis also, I mean, it's not mentioned from where it is starting.
Yeah, I agree. Now comes, I'm going to throw a hint. One more is there. Yeah.
Zero is also missing from 0 to
Yeah.
directly. I mean,
So you
0.5
understood
is
what
not there.
happens. Exactly. Now this is actually 0.6, man, and this is 0.7. Difference is only 0.1 percentage. But you look at the bar, this bar is less than half the size. You're seeing it. So it is,
Yeah.
you feel that, oh, super duper growth and all you will feel. But this is 0.6 and 0.7, not 60 and 70. Okay. And this size of this bar and this, you see how small this is when compared to this, when the difference is 0.1. Okay. This is how people mislead us actually. Sorry. Height has to be proportional, no? Correct. Height has to be proportional to the number. Difference of 0.1 cannot have such a huge difference in the bar. So we have to be cautious. Now this one.
Color combination.
Of course, yes. Super.
Percentage doesn't add up to 100%. It's
Again.
more than 100%.
Again, it is misleading. What they are trying to tell us is, out of people who I changed it to BJP, from BJP Congress and others, I just made it American, okay? Because Trump came recently. So now, what they are actually trying to tell is, if there are 100 people who support Democratic Party, 62 of them agreed. If there are 100 people who support Republican Party, 54 agreed. But what they did was, they confused us totally, and now we are expecting a total of 100% because there is no information on how many people they met. So they confused us with percentages. If it was numbers, let's say 16,000 Democrats, 20,000 Republicans, 13,000. If it was numbers, maybe we would have understood better. And you look at it, the size of this is also very important. This is 62. Now it looks like it is sitting inside 60. See, because of the font size, I am unable to relate. So more than helping me understand the data, the graph is confusing me. Now I'm all lost. Good, it started with 0 and all, but I'm totally lost. So when your differences between bars are very less, please don't jump 20, 20, 20. You can do 0, 10, 20, 30, 40, 50, 60. So expand the axis if the differences between the bars are very less. So that will help us understand the data better. Okay, that is the third mistake. Moving on. I want us to do this first. I'm going to zoom it, okay? Look at India, okay? I heard a female voice. Look at us, man. We are like ants, actually, compared to Australian women. Women, sorry. What is the problem here?
With just 5 inches of difference, they're showing different sizes.
Yeah, and
And
actually
it is
0
also
is missing.
misleading.
Yeah, 0 is missing. The difference between average height of an Australian woman in this case, and an Indian woman is actually 4 inches. You see, this is 5'4", this is 5 roughly. It is just a difference of 4 inches. But here we look like ants when compared to these gigantic Australian women. The problem here is, first of all, they replaced the bar with an image of a female. And they were trying to develop an infographic. Okay. And what happened was, when you increase a photo disproportionately, what will happen? They will look bigger than their actual size. So Latvian women are hardly 5 feet 5 inch average height, 5 inches more than Indian women. But you see the difference? So when you are converting a bar into some form of infographic, you should be very, very cautious. That is the flaw here. And then no 0 also. Okay. Now this, have you seen? Have you seen this chart? Anyone?
It's not adding to 100% first, and no.
Yes, that was an amazing catch. I did not expect. So this is actually called a donut chart. It's like polo, the mint. It's called donut chart. Same thing, it's actually pie chart only. But then we take off the center. Center part, we will dig a hole. Like a well, it will become. Okay. So it's called a donut chart. It is used as an alternative to pie. Yes, Excel gives you possibilities, but you should be very cautious. And the biggest catch is numbers don't add up to 100. And also, if I remove these numbers, no, if I remove these numbers, what will happen is all of them will look same, no? You see? If I remove these numbers, everything looks like 37 only. That is again a problem when you remove the contents of the center. Our comprehension level, our ability to understand and interpret such a chart becomes even bigger challenge. Now this one. Any findings? It's from a news channel only. I think some Fox News or something. Yeah, first go. Anything to tell?
It is not mentioning the geography or something, and 50. It is not adding up to. It is only 90% showing here, not
And
100%.
you see that these two are same, but height is different. Both are 17, no?
Yes, ma'am.
Okay. And now you see 13 and 17, height is same.
Age equal. Ji.
Okay. So, and then he's explaining. It actually came up in a channel. Okay. He's just going on and explaining. And nobody knows what is y-axis. Nobody knows. Okay. And how the study was done. No clarity. No clarity at all. Basically, they have done a study to understand what is the favorite season of the year among people living in a location, in a particular place. And majority of people have said that they like autumn, which is not there in India. So the fall season or the autumn season is their most favorite season. But the problem is this 17 and this 17, despite being the same number, they are of different height, and 13 and 17 looks the same. And this 17 and this 53, is the height proportional? This is almost 3/4 of 53 size, correct, no?
Yes,
So
ma'am.
when you are drawing a bar chart, be very cautious about the height. Whatever data you give, Excel will give you whatever you want, but then that is not enough. Okay. Now here, I think, yes, this is another one. Now forget the contents. Here I will tell you what has happened. See, all numbers are between 0 and let's say 10. Correct, no?
Yes, ma'am.
Now, but then the people in the graph, they have gone till 100. So this is
100.
not required only. If
Yes.
this was 0, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, we will understand the patterns. Otherwise, it will just look like a snake going. We don't understand anything. So be very careful about your y-axis when you are choosing a graph. Okay. And now we have something called, we make pamphlets, we make leaflets. So we tend to combine graphs. And then we come up with something what we call as infographics. So whenever you are planning some awareness strategies, you could combine your findings and come up with a nice leaflet where multiple kinds of graphs are presented. Okay. That is something for you to explore probably after our next session where we learn how to draw graphs. Okay. So today we have reached here. Okay. We were speaking about data, how to tabulate, and now we have reached how to present. Now, we will reach here only after you learn how to draw a graph and how to get it done in Excel. Excel has a lot of options. So some of the topics I have covered are here. I just clicked on Microsoft Excel, insert, graphs and charts, and I took a screenshot. There is column chart, there is line chart, there is pie, there is bar, there is scatter plot, maps are there, okay. And there is a tree map, histogram, different kinds of charts are there, which I would like to cover with you, provided we will have some engaging discussions on data so that we learn more about. Today we learned how to, when to use a graph, we learned. Okay. We also need to know when you should not use certain things. So if we have to do that, we need to have a very, very data-centric exercise. And I look forward to meeting you there as well. Thank you, and over to you, Dr. Meena.
Thank you, Dr. Vani. That was an amazing session. I should say it was like, for me, it was like going back to my biostatistics class in my UG and PG. It was excellently done. I hope in Mukesh's presentation, they also learned, the participants also learned a lot, I believe, because in the presentation, they could use mostly bar graph and line graph. But then now we realize that there are a lot more options available to better represent, to tell our stories in a more effective way. So that was done very nice. So yeah, I'm quite excited. Like the participants also, I'm also quite excited about your next session on, especially it's going to be mostly very practical, data-centric session. So yeah, we'll plan together. I hope participants also enjoyed this session and found it very useful. Any feedback from the participants? Mukesh, Neeraj, Chandan? How did you feel about the session? Was it helpful?
Yes, ma'am. Today, very excited and मतलब presentation क्या होता है ना, some मतलब कि visualization की मतलब एक ग्राफ हम
Your voice is breaking, Mukesh.
Hello.
Yeah. Please go on.
Ma'am, thank you so much, ma'am. I have learned a lot with ma'am to use the different types of chart, and we will try to apply it and work to start on it quick, ma'am.
Okay.
It is very you can call it fruitful for us, ma'am. Thank you so much, ma'am.
Very glad to know that. So the next session will be scheduled in the month of March. So we'll let you know the dates. If you find it very helpful, please encourage others also to attend these sessions. They might also get the benefit out of it. But in between also, I think we need to meet Mukesh with Yuvraj especially to take our conversation forward, especially about writing part with the data that you have, what we can do and all that. In the meantime, I also see there are a lot of possibilities for you to explore the new types of data visualization techniques like the scatter plot or be it waffle chart to apply to your own data. If you have individual level patient data, then for example, you can develop a scatter plot between socioeconomic status and TB notification, and then you can find out where the notification and from which group of the society the TB notifications are more. That kind of relationship you can find. I mean, just sharing. You can explore the many possibilities with a kind of different data visualization techniques. And the other thing, Pareto chart, like the districts, 22 districts where the notifications are coming, which should be your focus districts for more action, more strategies you need to plan. So those kind of findings can emerge by using Pareto charts. I'm also thinking at the back of my mind where it can be applied to your kind of data set.